So how can your perspective help promote people's recovery?
Well, as I often say, I'm as much influenced by Marx as Freud, and I'm very of the view that the social context and how it influences the way people think and interact with the world is important. So in the service, for example, that I lead in Birmingham here, for young people who've developed major mental health problems, I'm very strongly of the view that it's really important to get those young people back into a lifestyle and a life trajectory that their peers would expect, and not to kind of compartmentalise them or place them in context which is going to exacerbate that sense of loss of status or of an entrapment by a serious mental health problem. The question was, well, how can we help people recover? So at one level, I feel strongly it has to do with the way in which the values and the structures and the relationships that a service for people who've had mental health problems is operated. Very, very important. And in our service we have a lot of young people who've recovered and their lives have moved on this trajectory and are employed in the service or come back to provide mentorship and support to their peers to sort of show them that life can be, that life's not come to a full stop because they've developed a mental health problem. So I suppose that's a general level, something I feel very strongly about the structure of mental health services, their relationships and their values. I think that's really, really important. At an individual level, okay, well, how would you help someone recover and move along in life? Well, again, as a psychologist, as we were been discussing in the earlier part of our discussion, the way in which the kind of beliefs that people have and their early life trajectories and so on are, again, very important in trying to assess how you're going to help someone and move on. So the kind of things that I'd be interested in is, well, what beliefs or appraisals do you have about having a mental health problems, the appraisals of loss, shame and entrapment that we discussed earlier. I'd be very interested in understanding particular beliefs people might have about certain experiences. We talked about voices earlier, and I'm particularly would focus on how people fare and feel in their social relationships, because this is often the litmus test and the kind of touchstone of someone's well-being, how at ease they feel in interpersonal relationships. So I'd focus on that a great deal, and trying to understand how people feel when they go into a kind of social context or a social relationship, and what beliefs that individuals might have about what they think other people thinking about them. This is the cognitive behavioural tradition. So these sorts of beliefs and appraisals are the building blocks of the kind of cognitive behavioural therapy that is kind of well known now, and which is often misunderstood, I think, as being a kind of controlling, a professionally driven therapy, whereas in fact it's the complete opposite. It's a therapy that helps individuals to understand how they are negotiating their way through particular life events at work or in particular social relationships, and helps them to understand how their own assumptions about themselves or the world are brought to bear on a particular event or relationship that's causing them distress. So it's a very liberating kind of therapy, and it's a kind of therapy that is directed by the individual, and the individual is completely in the driving seat. Well, at least that's what a good cognitive behavioural therapist should do. It's an empowering therapy, and it enables individuals to understand and get control of a particular situation that's causing them some distress. So I think, just in summary then, those two things for me are very important. Trying to develop the social and service contexts in which people can recover and feel they can be liberated and be and fight free of some of the internalised stigmas and so on they may generate about their illness. And also, I work very much within a cognitive behavioural framework. There's as I say, a liberating one, enabling people to understand and to get control of their mental distress.
And finally, can I just ask one quick question about my experience in the past as a service user, experiencing a lot of mental distress, and my interactions with social workers and nurses, is that they are often don't know what to do with emotion when emotion arises in somebody. And my very good therapist has told me that always honour your emotions, but not necessarily attach yourself to them, so that you can go on, when it's inappropriate to say, be really upset and crying, so that you can go on and live your life. I think it's very important, and I'd like your view on how emotionally intelligent people in the care services should be when they're actually dealing with vulnerable people.
Well, it's interesting, isn't it? A lot of the training, for a lot of mental health professionals, not going to pick any out in particular, is very much within a kind of conservative kind of biomedical tradition that a lot of psychiatry follow. But I think it is true that in the training of a lot of mental health professionals, we tend to focus on whether someone has a diagnosis and delivering a certain kind of treatment, and are not terribly good at learning to deal with and respond to distress, other than passing someone some tissues and feeling uncomfortable. It's interesting, one of the reasons I think why a lot of carers actually don't often receive the help and support they always need, because a lot of carers are often very upset, for all sorts of reasons very angry, and sometimes that gets directed at mental health professionals. And there's quite a skill in being able to deal with that and not, as it were, taking it personally. It's emotional intelligence, as you say, and I think it's one of the reasons actually why a lot of relatives don't get a fair crack of the mental health services, because mental health professionals are not very good and not very well trained at being able to deal with that.
At the moment.
At the moment, and translating that into something positive.
Thank you very much.